what are the nasopharynx features? What are the features in the nasopharynx? This is the cavity of this is the nasopharynx. We can see here, this is the base of the skull, upper boundary, and this is the soft palate, and this is the nasopharynx. We will find the nasopharyngeal tonsil. Nasopharyngeal tonsil or pharyngeal tonsil اللي هنسميها another name is the adenoid at the base of the skull. Also we will find the auditory tube اللي هو Eustachian tube اللي هو قناة أوستاكي، فتحة قناة أوستاكي. auditory tube also it is in the nasopharynx. Also we have the presence of the tubal elevation. Tubal elevation اللي هو هذا هو حافة auditory tube that is formed of cartilage. It causes elevation, so we call it tubal elevation. Behind this elevation we have what we call a pharyngeal recess اللي هو جيب نسميه الفوسا of Rosen-Muller. Pharyngeal recess behind the tubal elevation called fossa of Rosen-Muller. And we have the salpingopharyngeal fold. Salpingopharyngeal fold هذه الفولد اللي هي formed by the salpingopharyngeus muscle. Salpingopharyngeus muscle اللي تمتد من auditory tube down to the pharynx. Salpingopharyngeal fold. So these are the features that are found in the nasopharynx اللي هي first nasopharyngeal or pharyngeal tonsils أو نسميها الأدينويد، الأوديتري تيوب Eustachian tube والتيوبال elevation، الpharyngeal recess اللي سميناه fossa of Rosen-Muller، and the salpingopharyngeal fold that is formed by the salpingopharyngeus muscle. عندنا الشيء المهم هنا انه اتصال النيزوفارynx with the tympanic cavity. يعني هذا هو the opening of the nasopharynx or the Eustachian tube here. It is continuous through the Eustachian tube to the middle ear، يعني مع الأذن الوسطى اللي هي tympanic cavity. لذلك هذا if there is a problem in the nasopharynx here it will become continuous، يعني راح تنتقل عندنا المشكلة للmiddle ear بسبب هذا الاتصال. هذه هي اللي قلنا عنها الادينويد أو الpharyngeal tonsils that is situated below the base of the skull in the nasopharynx. What are the pharyngeal tonsil or another name is the adenoid? It is a collection of lymphoid tissue، يعني تجمع لنسيج لمفي. طبعا هو يعني it have an immune function، يعني عنده وظيفة مناعية، وجوده in the submucosa of the roof of the nasopharynx. when it get enlarged، إذا صار بي enlargement، هذا هو تشوفون أنه قربة على الأوستيكيان tube. when it enlarge it will causes nasal obstruction. اعتيادي أول مشكلة راح يسوونها هي nasal obstruction انسداد بالأنف، والأوستيكيان tube obstruction انسداد قناة أوستاكيان tube obstruction، وبالتالي راح يأثر لنا على middle ear. so it will causes middle ear problem. Now the next to the nasopharynx down, oropharynx. You know why we call this part of the pharynx oropharynx? Because it's situated behind the oral cavity, behind the mouth. So what are the boundaries? Anteriorly is the oral cavity. Roof is the soft palate, and the floor is formed by the posterior 1/3 of the tongue. lateral wall راح يكون البالاتين. we have the palatine tonsils with its pillars. in the lateral wall we have the palatine tonsil with its pillar. والposterior wall راح نشوف عندنا هنا هذا هو posterior wall انه second and third cervical vertebra. So this is the what we call the oropharynx. Anteriorly oral cavity, superiorly is the soft palate. The floor is the posterior 1/3 of the tongue. Lateral wall we will find the palatine tonsil with its pillars. The posterior wall راح نلقى عندنا second and third cervical vertebra. هذا هو التونج. هذا this is the posterior one third of the tongue اللي هو راح يسوينا الفلور of the oropharynx. floor of the oropharynx. راح نشوف عندنا هنا كامتداد للposterior one third of the tongue we have this fold. هذا وحدة in the midline we called it median glossoepiglottic fold. Glosso it means related to the tongue. Gloss. Epiglottis this is the epiglottis اللي هو هذا لسان المزمار اللي هو نسميه الإبيجلوتس. So this fold in between is called the glossoepiglottic fold, median glossoepiglottic fold. And we have two lateral glossoepiglottic fold. So median glossoepiglottic fold and two lateral glossoepiglottic fold. In between these fold we have these depressed fossa that is called vallicula. It's called vallicula, or it is called epiglottic vallicula. This is a depressed area that is situated in between the base of the tongue and the epiglottis, surrounded by the glossoepiglottic fold. Glossoepiglottic fold. اللي هي أيضا تعتبر من ضمن الفلور of the oropharynx. نيجي قلنا in the lateral wall of the oropharynx we have what we call the palatoglossal and palatopharyngeal arches. هاي اللي هي مثل القوس الأقواس. Each arch is a mucosal fold that is overlies the corresponding muscle. ليش صارت عندي هاي الارش below it or ليش صار عندي هاي الفولد below it there is a muscle that takes the same name اللي هي اسمها نفس الاسم. يعني هنا أنا عندي اكو palatoglossal muscle to form the palatoglossal fold أو arch وعندي هنا palatopharyngeal muscle that form palatopharyngeal fold or arch. The interval in between the two palatoglossal arches is called the oropharyngeal isthmus and marks the boundary between the mouth and the pharynx. يعني عندنا we have the right palatoglossal fold and the left. هاي هنا عندنا right على الجهة left. In between them راح تسوي لنا boundary in between the oral cavity and the oropharynx. In between these two arches there is what we call the palatine tonsils اللي هي اللوزتين. Palatine tonsils are a collection of lymphoid tissue تجمع لنسيج لمفي that occupies the tonsillar fossa. هذه depressed area in between palatoglossal arch and the palatopharyngeal arch is called palatine fossa that is occupied by موجود عندنا هنا palatine tonsil اللي هي اللوزتين. Tonsillar fossa lies in between these palatoglossal arch fold anteriorly and the palatopharyngeal arch posteriorly. Palatine tonsil, its floor, the floor of the fossa يعني lateral wall is the lower part of the superior constrictor. موجود عندنا هنا muscle اللي هي laterally موجودة superior constrictor. حتسوين ال floor of the fossa or the lateral wall. The medial surface here is covered by a pharyngeal mucosa. Lateral surface is covered by fibrous tissue which forms the tonsillar hemicapsule. يعني من بعد the superior constrictor here we have a type of fibrous tissue that is called tonsillar hemicapsule. The neurovascular supply of the tonsils arterial. طبعا عندنا tonsillar branch of facial artery هذا هو المين blood supply. venous drainage كما شوفنا عندنا هنا موجود عندنا venous plexus of veins. والnervous supply to this area is through glossopharyngeal nerve اللي هو 9th cranial nerve. Lymphatic drainage of the tonsils to the deep cervical lymph node to the group اللي نسميها tonsillar or jugulo-digastric lymph node at the angle of the mandible, deep to the angle of the mandible. عندنا فد مصطلح نسميه الوالدايرز رينج. ring it means معناها حلقة. Waldeyr's ring. This is a ring of lymphoid tissue that surround the beginning of the respiratory and the digestive system. So what is Waldeyer's ring? It is a ring of lymphoid tissue, that is formed by the pharyngeal, palatine, and lingual tonsil. Surround the opening into the respiratory and digestive system. يعني يحيط بالمدخل respiratory والdigestive system. It is formed by superiorly موجود عندنا الpharyngeal tonsil superiorly والpalatine tonsil والtubal tonsil laterally والinferiorly موجودة عندي lingual tonsil مثل ما يعني هنا موجود مثل ما تعرفون أو إذا أخذتوا بالهيستولوجي posterior 1/3 of the tongue have lymphoid tissue collection of lymphoid tissue called lingual tonsil. بمجموعها راح تسوي لنا فتح حلقة راح نسميها Waldeyer's ring. الغرض من هذه الحلقة أنه تحيط لنا بمدخل الريسبيراتوري والدايجستيف سيستم، وطبعا وظيفتها هي الحماية against bacteria and viruses. The last part of our lecture is the laryngopharynx. It is the part of the pharynx that is related to the larynx here. It extends from the upper end or upper border of the epiglottis. هذا هو الإبيجلوتس. هذا الإبيجلوتس اللي هو يعني it is protective to the cavity of the larynx. يعني هذا يحمينا فتحة الحنجرة أثناء عملية ابتلاع اللقمة أو شرب الماء. It extends from the upper border of the epiglottis down to the level of the cricoid cartilage at the 6th cervical vertebrae. It lies behind هذا اللي هو هنا باللون السمائي. It lies behind the opening of the larynx. قاعد نشوف هنا حدود اللارينجوفارynx. It extends from the upper border of the epiglottis here down to the level of the 6th cervical vertebrae اللي هو الcricoid cartilage. It lies behind the opening of the larynx. The lateral wall, its lateral wall here, this is its lateral wall, is formed by the thyroid cartilage and thyroid membrane, and we have what we call two fossae that is called the pyriform fossa. هذه pyriform fossa, this depressed area is a depression in the mucous membrane on each side of the laryngeal inlet. هذا هو laryngeal inlet يعني مدخل اللارynx مدخل الحنجرة. On both sides we have these two fossa اللي نسمينها pyriform fossa. So it is a depression in the mucous membrane on each side of the laryngeal inlet. We call it pyriform fossa. Now we come to the nerve supply of the pharynx. We have three cranial nerves that supply the pharynx. The upper part, the nasopharynx, is supplied by the trigeminal nerve اللي هو العصب الخامس by its maxillary division اللي هو ال V2. هذا راح يكون الفانكشن مالته sensory. The oropharynx is supplied by the glossopharyngeal nerve اللي هو العصب التاسع 9th cranial nerve. هذا راح يكون motor and sensory. Motor, it is motor to the stylopharyngeus muscle and sensory to the oropharynx. يعني sensory لل posterior 1/3 of the tongue and the oropharynx. يعني عندنا اللارينجوفارynx lower part it is supplied by the vagus nerve اللي هو 10th cranial nerve العصب القحفي العاشر with a branch that is called internal laryngeal branch. حيكون اعتيادي motor and sensory. It is motor to all of the muscle of the pharynx and it is sensory to the area of the laryngopharynx. عندنا في المصطلح نقول عليه هو الفارنجيال plexus. هاي الفارنجيال plexus طبعا it is formed by these nerve اللي هسه ذكرناها من just the glossopharyngeal and the vagus, not the trigeminal. Pharyngeal plexus lies on the middle pharyngeal constrictor. It is formed by pharyngeal branches of glossopharyngeal اللي هو يعني التاسع, vagus nerve العاشر, إضافة إلى sympathetic branches from the superior cervical ganglia. إذا راح تشترك بالجلوسوفرنجيال فيجاس sympathetic branches from the superior cervical ganglia راح تعطيني sympathetic fiber. All the muscle of the pharynx is supplied by the vagus nerve except of the stylopharyngeus that is supplied by the glossopharyngeal nerve. هذا الرسم يوضح لنا هنا انه how the nasopharynx اللي هو upper part of the pharynx is supplied by the maxillary division اللي هو V2 maxillary division of trigeminal nerve يكون sensory، وبقية الأوروفارynx واللارyngoپharynx is supplied by the glossopharyngeal and vagus nerve. glossopharyngeal اللي هو العصب التاسع، وشوف هنا شلون منطيني برانشز للأوروفارynx، منطي برانش للعضلة اللي هي هنا نسميها الستايلوفارنجيوس، والبرانش اللي هو من فيجاس نيرف اللي هو نسميه الانترنال laryngeal branch internal laryngeal nerve that supply the mucosa of laryngopharynx. هذا هو اللارينجوفارynx وامتداده من the upper border of the epiglottis down to the cricoid cartilage. What is the blood supply to the pharynx is by branches from the external carotid artery. بهذا الرسم قاعد نشوف هذا هو common carotid artery. This is the internal carotid and this is the external carotid. From the external carotid artery it will give branches that supply the pharynx. We can see these arteries. This is the lingual artery, facial artery, ascending pharyngeal branch, or ascending pharyngeal artery. Ascending pharyngeal artery is a branch also from the external carotid, and for a branch from the maxillary artery. All these branches will supply the pharynx. Also, it will give blood to supply the tonsil. So we can memorize them. يعني نقدر نتذكرها من هذه العبارة. هو love father and mother. Love for lingual, father for facial, and for ascending pharyngeal artery, and mother M for the maxillary artery. All these arteries are branches from the external carotid artery. What is the lymphatic drainage of the pharynx? Is directly into the deep cervical lymph nodes. هاي مجموعة الليمف نود اللي راح تكون deep للexternal to the sternocleidomastoid نسميها deep cervical lymph node will drain lymph from the pharynx or indirectly via another lymph node اللي هي retropharyngeal نسميها retropharyngeal paratracheal اللي هي بالنتيجة همينة it will drain into the deep cervical nodes. آخر جزء من محاضرتنا اليوم هو تكملة للفارنكس. مثل ما تعرفون أنه البلعوم راح يستمر عندنا بتركيب ثاني اللي هو also it is a muscular tube which is the esophagus اللي هو المريء. The esophagus it is a muscular tube about 10 inches 25 centimeter in length. It extends from the pharynx to the stomach. It begins at the level of the cricoid cartilage in the neck opposite the body of 6 cervical vertebrae. It commences in the midline يعني بدايته تقريبا راح يكون بالميدلاين. But as it descends through the neck it will inclines to the left. It will inclines to the left يعني راح ينحرف إلى الجهة اليسار. اللي يهمنا هنا بالesophageal relation هذا هو الاسophagus which is a muscular tube. Anteriorly it is related to the trachea. هذه هي التراكية. These are the two recurrent laryngeal nerve. طبعا recurrent laryngeal nerve these are branches from the vagus. On each side it will run in a groove في الأخدود هنا in between the trachea and esophagus. Both these structure are anterior. قاعد أشوف هنا عندي posteriorly here هذا اللي هو باللون الأخضر أو باللون البرتقالي هنا. Posteriorly the prevertebral layer of deep cervical fascia والمصل موجود عندي هنا اللونجس كولي وموجود عندي الvertebral column اللي هو العمود الفقري. All these structure are posterior. بعد عندي laterally here laterally to the esophagus we can see that on each side the thyroid gland here this is the thyroid gland and the carotid sheath. Carotid sheath طبعا containing internal carotid artery و internal jugular vein وال vagus nerve. So the esophagus have anterior relation, posterior relation, and it have lateral relation. هذه في الصورة الثانية أوضح، تراويني ال anterior relation هنا التراكية والrecurrent laryngeal nerve. lateral relation موجودة عندي هنا ال common carotid artery internal jugular vein in the carotid sheath with the vagus nerve, and posteriorly we have what we call the prevertebral layer of fascia with the longus colli muscle اللي هي prevertebral muscle خلينا نقول longus colli muscle with the vertebral column العمود الفقري. What is the blood and nerve supply to the esophagus? To the esophagus we have the esophageal branches of inferior thyroid artery in the neck blood supply. النيرف القريبة هنا على الأسوفيجس هي two recurrent laryngeal nerve، هذه اللي هي ملتفة أو الصاعدة، وعندي أيضا السمباثيك nerve. So يعني راح يكون left and right recurrent laryngeal nerve و left and right sympathetic trunks. يعني راح يكون ال recurrent laryngeal nerve parasympathetic و sympathetic trunk will give sympathetic fiber to supply the esophagus. What is the venous drainage is to the inferior thyroid veins to the brachiocephalic trunk, and the lymphatic drainage is to the deep cervical lymph nodes. That is all about our lecture, which is the important subject للpharynx اللي هي مهمة تطبيقاتها بمادة ال ENT ear, nose and throat. Thank you very much.